What needs to change is the fact that we are no longer interested in our country, Nigeria. Gosh.
Are you ready? Camera rolling. Action.
Hello, everyone. My name is Modupe Laja. I am a physiotherapist and I'm well interested in community development, specifically the lives of women, children, elderly, and persons with disabilities. What inspired me is that I am a very curious person. And before writing this article, I became curious about out of pocket spending when it comes to healthcare. That is, Nigerians are spending ridiculously high amounts of money on their healthcare. I had to do my research because I wanted to know why. I wanted to know what was the reason behind it. And I got to learn that Nigeria has one of the highest numbers when it comes to out of pocket spending. In other words, a Nigerian is living their lives and then they fall sick. And when they fall sick, they spend money they never planned for and it makes a significant impact on their life. Inclusion is when every member of the society is involved in the growth and development of Nigeria. However, when a Nigerian falls sick and has to spend very high amounts of money on their healthcare, and because of that, they become poor, which we know poverty can leave a nasty mark on you. When you have poverty, or rather, when you are a poor person, we all know you can't go places, you can't do things. So, what does that mean? You're not included. When the government is doing things, you cannot be involved because you are not able to. You are not able to afford certain services, you're not able to afford certain products, and this affects your well being. So, it affects inclusion. The way forward is addressing this poverty. When we address the poverty, we improve inclusion. We ensure that every Nigerian is involved in the growth of Nigeria. When I read the story of Atinuke, it was really a story of a woman who was pregnant and already had plans for how she would deliver her baby. Yet, something she never expected happened, and she needed to spend an amount of money she did not have. This story is one of many where you did not plan for the certain things you encountered when you visited the hospital. This out of pocket expenditure is a story that many people lament, and it's a story we need to change. No, we no longer have to repeat such a story because such a story isn't the way forward. Such a story can be changed, and that is why I wrote this article. We can change the story by ensuring that even when you have an illness, even when you have a disease, it is not the end of the story. It is not the end of your life. There is a way forward, and you don't have to break the bank to get better. What needs to change is our high dependence on the government to do things. What needs to change is the fact that we are no longer interested in our country, Nigeria. What needs to change is that we do nothing. Now, for us to make this change, what we really need to start with is actually understanding what health insurance is about. When writing this article, I actually came across what is known as NHIA, National Health Insurance Authority Act, which was put into place in 2022. Now, this act is not known by many. However, it was developed to be better than what we know as NHIS. NHIA is supposed to be helpful to vulnerable communities. Yet, these communities don't even know it exists. So, what is the way forward? We need to increase publicity. And I don't mean just put it on the radio and that is it. I mean constant publicity. It should be on the billboards. We should ensure that whenever we have programs, people are talking about it. It should be a regular conversation when you meet your friend and you say, have you renewed your health insurance? It should be a conversation where you say someone has fallen sick and the first thing you're asking them is, have you gone to the insurance office? because health insurance is key. We no longer should live a life where because somebody is sick, we break the bank or we no longer have savings, because then you are not protected. Then our Nigerians fall victim to all kinds of practices, all in the name of cheap tricks, all in the name of shortcuts to better health. Better health and well-being is crucial to every Nigerian. And the way for us to achieve this is ensuring that we implement the National Health Insurance Act. So I call on you to no longer keep quiet. I call on you to no longer do nothing. I call on you to ensure you get your national health insurance, because it is important for your health and the health of your loved ones. Thank you. To you, listening to me right now, you want to write, but you're scared to do so. You want to write, but you're worried if anybody will read it. Go for it. You are the reason why you should write. Your curiosity is enough. Your desire for knowledge is enough. Your desire to share information with others is enough. The only thing I will tell you is to not remain mediocre. What I will let you know is there's a lot of room for improvement. You will always get better. So write. Don't just write for writing's sake. Write to change lives of people around you. And I know that you'll do an amazing job. Well done.